Good morning, everyone. Endocrine disorders. Previous class, we had detail about endocrine glands, hormones, and their functions, how control behaviors, over secretion are decreasing, what are the behavioral changes happened. So today we have to start with endocrine disorders, which means the abnormalities in endocrine glands as well as hormones which secreted by glands. Before I would like to ask question, Nancy Isaac, Nancy Isaac, Sona John, Sona,
Yes, sir.
yes, can you define hormones?
Hormones are the chemical substances secreted directly into the blood, which carries them to organs and tissues of the body. And it has particular functions.
Excellent. Thank you. Wonderful answer. Yes, endocrine disorders. Already we had been learned that endocrine directly affect the behavior, which directly related with health status of people. So what are the disorders happen? Endocrine system release hormones, control many important body functions, ability, change calories into energy, power to cells and organs. Definition: endocrine system influence how your heart beat, how your bones and tissues grow, even your ability to make a baby. It play a vital role in whether or not you develop diabetes, thyroid disease, growth disorders, sexual dysfunctions, and host of other hormone-related disorders. Types of endocrine disorders is subdivided into three groups. Endocrine glands, hyposecretion, which means hormone deficiency. Second, endocrine gland hypersecretion, hormone excess. Third one, tumors, benign malignant, which means cancer of endocrine glands. So these are the three important disorders, mainly hyper, hypo, and tumors. First, detail about hyposecretion. Acromicria in adult due to hyposecretion of somatotrophin. Symptoms mainly bones, faces. Can picture available here. Look at this. This is normal one. This is due to hyposecretion of somatotrophin. Next, Addison's disease. Hyposecretion of aldosterone. Symptoms: hypertension, dizziness, vomiting, diarrhea, sugar, low plasma, mainly potassium and nitrogen, calcium, pigmentation of skins. Look at this picture. Addison's disease. Can you see that?
Yes, sir.
Thank you. Next disorder, cretinism in children. Means cretinism. Hyposecretion thyroxine. Symptoms: growth factor, low intelligence, mainly physical growth as well as mental growth, delayed sexual maturity, this picture shows that disorder, diabetes insipidus, hyposecretion, vasopressin. ADH already we had been learned in these types of hormones. Symptoms: the enormous secretion of urine, which condition is called polyuria. Excess thirst, polydyspersia, etc. Look at this picture available. Kidney over drinking through thirst as well as urination. Disorder: diabetes mellitus, hyposecretion, insulin. Symptoms: high sugar level, glycosuria, which means sugar in urine, polyphagia, overeating, polydyspersia, excess thirst, and polyuria, frequent urination. So in medical terminology concerned, poly means excess. Okay. Diabetes mellitus, look at this picture available. Type 1, type 2. Disorder: myxoedema in adult due to thyroxine hyposecretion. Symptoms: physical sluggishness, mental dullness, low metabolic rate, etc. Look at this edema. Disorder: Down vision, hyposecretion, somatotrophin, which leads symptoms mainly short in structure. Picture available. Look at this. Disorder: tetany due to hyposecretion of PTH, parathrombin, symptoms: blood calcium drop, abnormal rise in excitability of nerves, muscles, mainly larynx, hand and feet. Pictures available here for better understanding. Look at these pictures. Disorder, aneurysm. Due to hyposecretion of testosterone. Symptoms, lack of male secondary sexual character. So sexual disorder due to we know that testosterone is sex hormone. Sterility. Then disorder due to hyposecretion, simply available here. Acromicria in adult due to somatotrophin. Addison's disease, aldosterone, cretinism due to thyroxine, diabetes insipidus, vasopressin, diabetes mellitus, somatotrophin, myxoedemia, thyroxine, Down fission, somatotrophin, tetany, parathrombin, onychoidism, testosterone. Then hypersecretion disorders, acromegaly in adult due to oversecretion of somatotrophin. Symptoms, abnormal growth, lower jaw, hands, lungs. Pictures available, look at this. Disorder, adrenal virilism in female, sex corticoid due to oversecretion of this hormone. Symptoms, growth of mainly male voice, male characters. Look at this growth of hair. Then disorder, KUHS syndrome due to oversecretion of aldosterone. Symptoms, headache, excess urination, excessive thirst, increased volume of blood. Disorder, KUHS syndrome due to hypersecretion of cortisol, high blood sugar, obesity, deposition of fat in face, etc. You can see in the picture clearly. Disorder, exophthalmic goiter, Graves' disease due to oversecretion of thyroxine. Symptoms, thyroid gland hypertrophy. Then increased metabolism, high rate of heartbeat, restlessness, nervousness, loss of weight, Look at this picture, shows that then disorder, gigantism in children due to oversecretion of somatotropin, growth hormone, excessive height, extreme bone, etc. Look at this. We can see this picture. Then disorder, hyperglycemia, due to oversecretion of glucogen. Symptoms, polydysplasia, polyuria, blurred vision, weight loss, poor wound healing, hyperglycemia. And disorder, glucogen, hypersecretion of insulin. Symptoms, hypoglycemia, as we had seen in the picture earlier, fatigue, temperature, body temperature may suddenly fall, unconsciousness may happen. Disorder kidney stone, due to high oversecretion of prothrombin, symptoms, accumulation of calcium in blood, phosphate from kidney stone, accumulation of calcium. Look at this picture. Next disorder, osteitis, fibrosa cystica. Hypersecretion of parathyroid. Symptoms, calcification of the soft tissue. Look at this. The picture shows that calcifications. Then tumors, malignant in endocrine glands, classified according to the particular endocrine gland that involved. Then types of cells from which cancer developed. Then part of body that is affected. The following types: adrenal gland tumors. So mainly this may be abnormal growth in the adrenal glands, or tumors may cause abnormal secretions. which leads to other endocrinal disorders due to hyper or hyposecretions. Then multiple endocrine neoplasia, MEN1, then multiple endocrine neoplasia, MEN2. Then pancreatic cancer in pancreas, which cause may declining the secretion or abnormal secretion of insulin. Parathyroid gland tumors, pituitary gland tumor, thyroid cancer, so these are the abnormalities in glands mainly. So detail we will learn in medical surgical in next year onwards. Mainly endocrine disorders. In psychological aspect, we should be think about it. The endocrine glands and their secretions directly affect the behavior which impact health status of people, individuals. Then maintaining a healthy glandular system. Student, in psychological aspect, this is focusing area. As we had detail about it, glands and hormones only determine behavior. So when we control the hormone secretion, we can make our body and mind become healthier. How it's happen? The person experiencing the disease, communicable as well as non-communicable diseases, due to hormonal factors. How to maintain healthy glandular system? We can control through following bases. 1. Exercise regularly. That exercise should be movement for every body organs. Aerobic exercise, strengthening muscle exercise, which help to secrete hormones normally. The World Health Organization emphasizes that at least 30 minutes walk 6 to 5 days in every week. 30 minutes is enough to stimulating every body parts. Second, food habits. Include raw food and good fats. Good fat means soluble, which is not deposit in the body. Then keep our blood sugar level balanced. So food habit is very important, and we should be controlled reasonable amount of food. Third one, eat smaller portion of size, which is very important one. Somebody eat more food in a time, what will happen? Difficult to digest. Hormones may be secrete, insulin, and overburden to glands. So small portion of eating help to easy to digest this reasonable secretion of hormones and provide energy to every parts of body, but not energy for body as well as mind. Fourth one, consume easily digested proteins. Some diets may be hard to digest. Fifth one, supplement with high quality products. Mainly minerals. Sixth one, start to relax early in the evening and get into sleep. So should we go too early for sleep? Okay, then get up early morning, which help to more relaxation in body and secrete normal hormone level. Seventh one, listen to relaxing, encourage uplifting music. Listening music is one of the important way to relaxing our body and mind. Help to mainly mind first, then body, and help to normal secretion of hormones. Eighth, replace negative thoughts with positive thoughts, which is very, very important one in psychological aspect. Many people experiencing this stress due to negativity. Everything thought about negative. Mainly positive attitude towards self is very, very important. And building confidence. Positive thought regarding every aspect, regarding their own body and mind, then social aspect in religious, positive religious thought, and in workplace, etc. In students concerned, mainly study. Positive means creative, which means productive lifestyle should be promoted. Then positive attitude towards religion. It means way to behave towards religious practices. Any religious practices harmful to us should be eliminated. As we know that many people have been suffer from superstitious belief. In Malayalam concerned, Andhaviswasam. So should be eliminate superstitious belief, promote positive attitude towards religion, to enrich normal secretion of hormones in our body. Then encourage positive emotional outlets like traveling, hobbies, club. Which means organize every day, become happier. Every moment plan to organize. Positive emotions, mainly happiness, which concern. In other words, enjoy the day. through positive activities and creative activities and positive thinking, etc., which create positive emotions. Then body-mind relationship, modulating process in health and illness. Examination aspect, this question may be asked in this. As we had been learned that body may determined by what are the factor, brain and behavior, gland and behavior, muscle and behavior, First point, psychobiological causes of disease. Psychobiological causes of healing. Fact is that mind and body relate directly linked with to determine diseases. So which is medicine? Mind is medicine. How to build positive thinking and mental factors which create healing effect. Psychobiological causes of diseases, some explanation here. Mainly lower structure of our brain, cerebral hemisphere involve regulation of emotions and body physiology, which already we had been learned in earlier. So this is the examination aspect. This question may be asked in this examination, 5 marks, short notes. Then psychobiological causes of healing. Healing is to be accomplished. Immune system must be called into play. Mind to accomplish this, which means this mental factors, mainly positive thinking, positive attitude, positive perception, help to increasing the immunity power, which cause to heal diseases, mental illness as well as physical illness. Then mind body communication and healing. Communication between mind and body via, look at this, lymphatic system in hypothalamic system. Already we had seen that picture earlier, lymphatic system. Encoding information, depending upon memories, learning and behavior. And all healing methods of mind and body functions by accessing and reframing the state depends memories and behaviors. Psychological and physiological healing depends on encoding of mind, body, symptoms and problems. So next, in psychologically aspect, we should be focused on placebo response. Synergistic interaction of both healing methods. Students, placebo response means, for example, which is determined by individual belief. And many people believe that take medicine can cure the disease. So placebo effect, placebo medicine as well as may be administered by the doctors, maybe, as well as every nurse should be know about it. It's a psychological medicine. There is no physical, biological effect. For example, if a patient comes in the hospital with belief that a pain, or any other fever or any diseases, but clinically normal. Example, if a patient comes in the hospital with fever feeling, but symptoms and vital signs are normal temperature, but a patient feel fever, what will happen? That time this medicine use, placebo medicines. A drugs may be given, colorful drugs, or injection may be injected, but there is no medicine, biological effect. But a patient feel that I have take medicine, the disease gone away. So which is placebo. Clear about it? So not only this aspect as well as the different types of this therapeutic aspect, the placebo medicine use, psychological medicine. Mind, body, immunomechanism. So which is a fact? The mind only determines the secretion of hormones, as well as determine the immunoresponse. If a person feel stress, the body hormones abnormally secrete. Stress hormone may be higher level. Immune system will be declining. Immunity power, which cause opportunistic infections, so which leads to communicable diseases as well as non-communicable diseases. How healing and immunomechanism? It's a recent research, immunological research, bridge between mind and body by behavioral conditions. We can enhance immune system. We are capable of making ourselves sick as well as making ourselves well. So mainly which is determine the behavior, we can modify behavior, can capable to promote well-being, enhance immunity power. Then our mind have the ability to facilitate healing. And not only mental mind healing in the mind as well as mental health illness, also healing to cellular and biochemical levels. This is one of the philosophy. I am the master of mind. So students, I would like to advise to every student, just think about your mind. What do our mind? Which means insight. Think about our mind. What do? What they think about, whether positively think or negatively think. We can control our mind. That is, I, the master of my mind. So which is my advice, everyone, we are students, nursing students, should be watch our mind every day, at least. And what we have been thinking, whether positively thinking or negatively thinking, which help to modify our mind, mainly thinking, modify our behavior, and empower and enrich mental health as well as physical health. So various disease, the psychological medicine based on this only. So we can advise to our client after complete this course, become wonderful nursing professionals. Next is that I think, therefore I am. Next, philosophy of mind and body. When we think positively, our mind and body will be pleasant. When our self-image become positive, become pleasant as well as well. So clear about it? So implications we will learn next class. Implication to nursing, which is the important area. So this unit we had been learned wonderful knowledge regarding body and mind. Mainly today focus on endocrine disorders, hypersecretion as well as hyposecretion. But then due to the tumors, biological causes. The highlights of today's discussion is that embracing knowledge is that how we can determine our body which type of hormone should be secreted. We can control and maintain balance, secretion of hormones through various, I was given 10 points I was given how to maintain healthy glandular system. Mainly exercise, fat-free food. You can eat fat, but should be eat soluble fat. Should be think about. So this is important knowledge for our individual life as well as professional life, professional aspect. We can guide and give counseling as well as guidance our client. First, think about self as well as our knowledge. So this knowledge not only in psychological aspect as well as other specialties use in medical, surgical, maternal health, mental health, use this knowledge. Then body mind relationship. The key point is that I, the master of my mind. So everyone think about it, everyone say that, I, the master of my mind, I can control my mind. I can drive my mind and promote positive thinking and enhance immunity power, promote healthy and wealthy. Then I would like to ask question. Nancy George,
Yes, sir.
what's your opinion regarding today's discussion?
Yes, sir. Today's discussion all about the endocrine disorders,
Yes.
both hypo and hyper.
Yes.
Then totally we have studied how a body or how a person's body can determine the which type of hormones to be secreted, and how a person can maintain and balance the hormone secretions of one's body.
Yes. Excellent, Nancy. I would like.
And
Okay. More.
okay,
Okay, it's enough. Excellent answer. Thank you, everyone. Have a wonderful day. Enjoy the day.
Thank you, sir.
Thank you.
Thank you, sir.
Sona, yes.
thank you, sir.
Thank you, sir.
Okay.
Thank you, sir.
Yes.
Yes,
Yes, sir.
Yes.
Thank you, sir.
Okay.